Hello, I'm Dr. Bernadette Riley, and today we're here at the Scope podcast to highlight a conversation with two wonderful fourth-year medical students who've been doing lots of research on Ehlers-Danlos Syndrome and the co-occurring conditions associated with it. And today we're really going to focus on our discussion on the challenges of diagnosis and care and the ongoing student-led research initiatives here at NYITCOM. As I stated before, I'm Dr. Bernadette Riley. I'm professor at the Department of Family Medicine at NYITCOM. I'm the director of NYITCOM's Ehlers-Danlos Syndrome Hypermobility Treatment Center, and I like to focus my care on the complex patient and also mentorship of student researchers. I would like to introduce two very special student researchers and students, Annette Pietraru, who's a fourth-year osteopathic medical student. She has an interest in OB/GYN and maternal fetal medicine, as well as reproductive endocrinology. She has been involved in multiple EDS-related research projects, and from her first day as a medical student, has shown a passion not only for research, but also for clinical care, and has just been a wonderful addition to our center. It's been an honor to work with you,
Thank you,
Annette.
Dr. Riley, for the introduction.
Next, we have Emma Rivellese. She's a fourth-year osteopathic medical student. She has a clinical interest in pediatrics and genetics. She's participated in much EDS-focused research and case studies throughout all of her years here. She's also received many awards, including the NYITCOM Alumni Association Award. We're so happy to have Emma here today.
Thank you so much, Dr. Riley.
All right, we're very excited to be here today and to start this very important discussion. Dr. Riley, we just wanted to have you answer just our first question, an overview on the EDS, kind of what is it, why is it often misdiagnosed or diagnosed late, and what conditions co-occur with EDS?
Annette, that's a very hard question. Even something like diagnosing or speaking about what is the Ehlers-Danlos syndrome is challenging. First of all, it has changed throughout the years, the diagnoses and the different subtypes. So as of today, there are 13 different subtypes of the Ehlers-Danlos syndromes. A rare 14th one was added in 2018. And I'm very curious to see what the new diagnosis sets, which is coming out perhaps in 2027 or at the end of 2026, is. But what we do know as of today is that there are a group of heritable, or so we think, connective tissue disorders that could affect every part of our body, from our head to our toes. There are many co-occurring conditions, many of which are things like hypermobility, which is when your joints are flexible, chronic pain, some dermatologic manifestations, but there's also patients who can present with a subset of co-occurring conditions, such as mast cell activation syndrome, MALS, medium arcuate ligament syndrome, and POTS, which as of today is pastoral tachycardia syndrome. So the EDSs are really unique. Each patient can present with different types. It's a challenging diagnosis to make. However, I think the prevalence, also the amount of information about EDS has been dispersed a lot more to the medical profession and the lay community, that I think we are becoming more familiar with it. And so that's what EDS is as of today.
Great. And one more question for you. When should a clinician suspect EDS in their patients?
Okay, so as of the different subtypes of EDS could answer that question. For example, I could give you some examples from my patients. I'm also a clinician at the clinic. So sometimes people come to me with the diagnosis after being diagnosed by a geneticist because a family member, a first-degree family member, perhaps were diagnosed with a genetic type of EDS. So they would come to me saying, okay, this first degree family member had it. So then I was told to see the geneticist. And it turns out that in my blood test, I have this. And now what do I do? So that could be a way to suspect, okay, if let's say some family member of theirs presents with a type of EDS that we know the gene. So if someone came to me and said, you know what, I'm here for hypermobility, but my mother has vascular EDS, that's something that a clinician should have a big red flag for. A lot of times, one of the diagnoses of the HEDS, which is the one that as of today, we do not have the gene for, it's a clinical diagnosis with a strict 20 guideline from 2017. For that one, a lot of times it's chronic pain presenting in 2 or more limbs for greater than 3 months. A lot of times it's a constellation of symptoms, perhaps sensitive, recurring scarring, sensitive skin, reactions to different types of medications, hypermobility, dermatologic manifestations, psychiatric and psychological manifestations, cardiac manifestations. We've done research where 97% of our patients present with some kind of cardiac complaint. So you should have a good idea of what you're looking for. And for those people, I would say a red flag in saying, gee, is a lot of times the co-occurring conditions that are seen in EDS, such as MALS, SMA, superior mesenteric aortic arteries, aortic aneurysms, family history of EDS, and hypermobility are the big ones.
Great. So it seems like, open communication with, your patients is very important for, uncovering, like you said, those co-occurring conditions that could lead you along the path for diagnosis. And so as Emma and I have observed in your clinic, we see, how you speak with your patients, how you're very open and honest with them, and you build rapport. So that's something that, we observed and we really appreciate seeing because, a lot of these people living with EDS, they often feel misunderstood and not really heard or represented. So that's really what drew Emma and I to research in this field, is to answer those questions that are still unanswered. And we saw that when we were rotating in the clinic, the people with EDS told us exactly, what questions they have. And that kind of opened our eyes to other areas of research we could look into.
And they really know themselves best. They'll tell you, this is what's going on with me. This is what I'm concerned about. And it's really, you just have to listen and they'll give you all the answers.
Annette, thank you so much for saying that. I really appreciate it. It feels a lot. It comes a lot and means a lot, especially coming from you two, who I've worked closely with. And I have no doubt that when you both are on your residency, which is coming very soon, that you will feel not only fully confident, but also be as compassionate and passionate as you are as students with your patients.
Thank you.
It's a wonderful. It's wonderful to work with medical students, and I know my patients also enjoy having medical students because it also increases the education on EDS, which is something that I think patients of all symptoms or conditions with chronic pain hope that the medical profession and providers who take care of them have an idea of what they're going through. So now I have a question for Emma, actually. Mm-hmm. Emma, what role does mentorship play in supporting student research in complex conditions?
So I think, especially with something like Ehlers-Danlos, it can be hard to find clinicians and research about it because it is considered a rare condition. So when I was looking for med school, I specifically chose NYITCOM because of the clinic, and I wanted to come see you and see those patients. So I think that it's been really important to have someone kind of guide us through the research roles and the process, because coming in, we didn't really know too much about it. And I know, at least for me, I came in with 1,000 different project ideas that maybe weren't going to pan out, and you were really able to help us kind of narrow down And you introduced the two of us because we had come to you separately, and now we work great together. We do lots of projects together, do everything. And so I think that that's really important to kind of have someone guiding that process.
One thing I do want to point out is Emma and Annette are published researchers. They have published, they have presented, they have multiple posters. This year we worked in different medical schools, North Carolina, osteopathic medical schools, that we worked with different osteopathic medical students as well. So through their research, they were also able to get a lot of presentations that I think are going to help them throughout their residency, but they were also able to do a published paper regarding the ketogenic diet in the OFP. And they've learned the process not only of presentations and the importance of public speaking, but also the process with regards to the publication process, the peer review process,
Very
going
much.
through that. Yeah. So, Annette, how do these research projects contribute to the broader goals of the EDS Hypermobility Treatment Center?
That's a great question. So, again, I agree with everything that you both said so far. And, when we came to Dr. Riley in our first year of medical school, we weren't really sure of what we wanted to research. And of course, seeing the patients in the clinic and understanding their struggles, we kind of understood what areas we wanted to research. And Dr. Riley, who has a master's in nutrition, that was kind of like our first project, was looking at the ketogenic diet in EDS. And so the ketogenic diet was historically used for patients with epilepsy because it has, anti-inflammatory properties. And so through our research, we found that the anti-inflammatory effects of the ketogenic diet could help with patients with EDS. And so that was a great paper that we did publish last year in OFP, and we learned a lot through that. Another project that we looked at was women's health in EDS, which I was particularly passionate about because I'm going into the field of OBGYN, and uncovering the different obstetric and gynecologic co-occurring conditions with EDS is very important, especially as a future OBGYN. I hope to welcome as many EDS patients as I can in my future clinic, and understanding, the effects of tissue healing, for example, how it's delayed in EDS patients is very important for labor and delivery management. And lastly, another project we recently worked on was a case report that we worked on with another osteopathic medical school in North Carolina, and kind of having different medical students, different clinicians on that project, all working on, the common link of understanding EDS more was super important, because we were able to present that research at different conferences, across the country. So there's still, a lot of stones left to be turned, but we're really excited to just be contributing more to the field.
Definitely.
Yeah. Emma, I don't know if you have anything else you would like to add. You've been, a great help in this whole process.
Yeah, you're awesome as well, both of you. I'm just really happy to be able to contribute to the EDS knowledge. I think that's a big thing that's always kind of missing, is getting more information out there, especially about the co-occurring conditions, especially with our Miles paper talking about misdiagnosis, and the lack of awareness of these conditions really leads to misdiagnosis and long suffering for the patients. So trying to kind of bridge that gap and get more information out there to hopefully help some future patients is really important.
And Annette and Emma are not only wonderful academic students, but they also came from their first year to me with a specific research idea in mind. They didn't just ask, oh, can I be added on a study that's already there? They wanted to contribute to the field on their own with their own ideas and choices. And for students and also professors who get a lot of research requests from students to have an idea of what you want to speak to them, I think that would be important. Which leads me to my next question, which goes to Annette. What advice would you give students interested in research on rare or complex conditions?
Yeah, that's a great question. I mean, the first thing would be to find, a field that interests you, or a field, like in our case, that had a lot of unanswered questions. And so also finding a great mentor like you would be great because of course, you want to have the freedom to kind of research what interests you, but also have that guidance on what to do next, what to change. And I know we've had so many meetings over the years of, what we can improve on. And it's really benefited us both academically and like you said, presenting at conferences has helped us, with our public speaking skills, networking with different physicians,
learning at the
absolutely.
committee meetings, learning about different conditions.
So yeah, overall, learning from you through research has helped us tremendously as students and as future clinicians.
Yes, and learning from my students has helped us too. And my example with regards to professors, because I think every professor, especially at NYITCOM, who have such a passion for helping students, can be a mentor and a research mentor at that. I think you have to learn a lot about the research process, especially for a clinician like myself. A lot of it is, taking classes about research, trying how to do qualitative reviews, learning about Prisma, learning about the publishing process and those things. So I think every professor and assistant professor, associate professor has the possibility to be a wonderful mentor. And I think that connection is a challenge in a busy world, but I know my time with Emma and Annette has really increased my I've learned so much just from them. So it's really brought me a great joy, and I appreciate all you two have been for me, and you've been exceptional students.
Thank you so much.
Thank you.
So future physicians, we look forward to hearing about, especially the ones from NYITCOM graduating. I can honestly say, I think they do get an education at NYITCOM, especially in EDS, but in complex conditions. We have a lot of centers at our clinic. And we have the 4th year EDS elective, which I am looking forward to having Annette and Emma do with me. I've had wonderful students, many of whom are in their residency, who I still keep in touch with. I'm thinking of them. And I'm just so honored that so many people now know about Ehlers-Danlos Syndrome. When I do the interviews for the school, many of the future physicians coming in say what you said, Emma, that part, they have a passion for EDS or they have EDS and they, or hypermobility, and this has affected them. So it's just, I'm excited for the future. I see that the condition is increasing in prevalence, and similar conditions such as mast cell and the nutritional aspects. I'm glad that the American Medical Association and the AOA recognizes the importance of nutrition in chronic illnesses of all sorts, including EDS. So the future of future physicians, as can be seen by Emma and Annette, is really in good shape, especially at NYITCOM. I'd like to thank Susan and Steve, who are amazing with the podcast and helping us, and Connie too. Connie Rim, we miss you. And just, we'd like to close this episode. Is there anything you two would like to add?
I don't think so. Thank you so much, Dr. Riley.
Thank you so much for everything.
You guys.
It's been an honor, and thank you for letting us do the scope.
Thank you.